Hi, Bother Brigade. Here's what's bothering me today. I know there's a lot going on right now with Russia and Ukraine and gas prices, and because of the whole Russia-Ukraine thing, that's going to affect wheat prices as well. But hate to remind people, there's still a pandemic going on. And that's what we're going to talk about today because there is some disturbing data and trends coming from various corners of the world. And it means that with us ending restrictions very soon here, we're likely going to see similar things in our corners of the world. So, unfortunately, let's dive into, first of all, a few graphs. So these are daily new confirmed COVID-19 cases per million people. And you can see that the Netherlands, Germany, Greece, Portugal, the UK, and Italy have all basically done U-turns. They were on the downward trend, and now they're spiking up. And then if you compare those to how this started at the very beginning of the pandemic, when we had lockdowns, and then, a year later when things got crazy again, it should really show people how terrible the situation has become. Also, who knows if these case numbers are accurate considering how many places there are now that are underreporting numbers because they aren't properly testing, right? Because we've steadfastly refused to do the right thing with regards to this pandemic. Anyway, next graph. Weekly new hospital admissions for COVID-19 per million. So really bad in late March of 2020, and then really bad again over the holiday period in 2020. And here we are in March of this year, improved over the previous two times, as you can see for Ireland, UK, and Netherlands, but still concerning that those have not dropped down to a very low level and are instead continuing from about what amounts to a midway point. Which brings us to this absolute banger of a headline that I saw today. COVID cases and hospitalizations in England are rising, and experts don't know why. Hey, I think I might have the fucking answer for you. But as someone else decides to very accurately sum up, why does learning to live with COVID always seem to mean pretend it doesn't exist anymore instead of keep a few basic precautions to protect vulnerable people? Yeah, why does we have to learn to live with COVID suddenly mean we should just give up and let people die and run the risk of dying? And also, again, long COVID, which is basically a disability. So, why is it that instead of, oh, we need to, take some very basic precautions to help protect each other, right? I thought we lived in a society, but that's a story for another time. Anyway, second to last graph. Daily new confirmed COVID-19 deaths per million people. This is for the country of Denmark. As you can see in March 2020, pretty terrifying, or it was terrifying back then, and then it got under control, and then they opened up again. Twice as bad as the previous wave, and then they got under control again. And here we are looking to be, 3 or 4 times as bad as the previous wave. It's basically a flat line upwards. And I remind people that Denmark recently lifted most of its restrictions because it's time to move on, apparently. These are the COVID deaths. And this is, again, a, well-established Western, democratic country, right? Like, they have all the money, they're capitalist, and yet here it is, just failure and giving up for all to see. And this is, again, probably due to the BA.2 variant, which is as infectious as the Omicron variant, or more infectious, also more severe. So, fun. This brings us to the second half of what I wanted to talk about today, which is something that some places have been reporting on, but it hasn't entered the public consciousness yet. And that's what's happening in Hong Kong. This is the daily new confirmed COVID-19 deaths per million people in Hong Kong. It was basically a flat line over the entirety of the pandemic due to China's zero-tolerance policy against COVID. And then it slipped in, and it is absolutely wreaking havoc in Hong Kong. And the situation in Hong Kong, which again, I really want to stress, right, is part of the whole Chinese idea of let's try and just have a zero tolerance policy. We can't let it spread to the various other corners of the country. So you just got to massive, if we need to lockdowns, massive testing, we really got to get this under control, right? So here's what's been happening in Hong Kong over the past month with the BA.2 variant. Hong Kong contained COVID for 2 years. Now it has more cases than New York City and London. On Thursday, Hong Kong recorded over 6,000 COVID-19 infections, meaning in absolute terms, the city is reporting more daily cases than New York City and London for the first time since the spring of 2020. It's a stunning fact considering both the US and UK have long given up on containing COVID-19. Authorities in Hong Kong, meanwhile, are deploying measures like contact tracing and mandatory quarantines in a bid to eradicate the virus from the city. Up until its most recent wave, Hong Kong, a city of 7.4 million people, had never recorded more than 173 infections in a day. Weeks-long hotel quarantines for residents entering the city, intense contact tracing, and isolating close contacts of positive cases proved successful in keeping the virus out of the city and allowing residents to live largely COVID-free for the majority of the past 2 years. So there's the background, right? That city with, again, millions of people and actually taking the virus seriously with like isolation and mass testing, it meant that residents could, after periods of isolation, kind of live COVID free. Like, okay, we can still go out, see each other, do things in relative safety. Yes, mask up just to be safe. And so life in many ways kind of carried on as per normal in Hong Kong for the better part of the past 2 years because they took it seriously. And it also shows how, again, they're super low numbers, right? And then they exploded so that it's more than New York and London right now, which are the financial centers of countries that have given up the fight. So that's kind of a goddamn warning sign for what we can expect in the near future. But anyway, moving on. Hong Kong mortuaries hit capacity as COVID-19 deaths climb. Facilities for storing dead bodies at hospitals and public mortuaries in Hong Kong are at maximum capacity due to a record number of COVID-19 fatalities, the hospital authority said on Monday, as officials battled to control a surge in cases. The global financial hub reported a daily record high of 34,466 new coronavirus infections and 87 deaths on Monday, health authorities said. That story came out on Monday, February 28th. Just 2 days later, however, Hong Kong reports record cases, movements may be restricted. Hong Kong is planning to test its more than 7 million residents as it grapples with soaring numbers of COVID-19 cases in its worst outbreak of the pandemic, linked largely to the Omicron variant. Officials on Wednesday reported 117 deaths, taking the total number above 1,000. About 80% of the deaths have occurred since late December, most involved elderly patients who were not fully vaccinated. So one of Hong Kong's failures is that they did not effectively vaccinate their most vulnerable population and the elderly. It only sits at like 55% if memory serves me correctly. So we should hopefully be spared that here in Canada because our elderly population is more heavily vaccinated. But this is kind of a glimpse between this and Denmark and the other ones where we showed a sudden U-turn in hospitalizations. This is unfortunately what we can expect in the future moving forward as Canada and its provinces basically give up the fight against COVID-19. And then there's also America, which is entirely given up. And so what we are going to see likely with the unvaccinated or only partially vaccinated is as BA.2 spreads, because it's a variant of the Omicron variant, it's just a more severe strain, you're probably going to see more deaths, more hospitalizations, which is only going to stretch the system even thinner than it already has been. And so those poor frontline workers are still going to have to deal with that. And it's probably still going to rip through more people, whether they're vaccinated or not. As you've seen with Hong Kong's zero tolerance approach, and they're still trying to mass test everybody, but it's already clearly kind of gone out of hand, at least by their standards and definitions. So this means that as things end in March and April, and as the travel is still allowed everywhere, and we are going to likely see the BA.2 variant come in and spread like wildfire and hospitalize people, this means that unfortunately right now it is more crucial than ever to protect yourself in whatever way you can. Wear a mask, and N95 is preferable, but just anything you got is better than nothing. And it also means, unfortunately, that we are going to do this same fucking song and dance in a few months from now. And people are going to think, Come on, why can't we get over this? And I am going to scream into the heavens about all the ways in which we have failed ourselves and society at all levels over the course of this pandemic, and how that is to blame for all this, and buying into misinformation and not tamping down on it, and not actually getting information and support and resources out to people, and really taking this as seriously as it needed to be taken. And unfortunately, that means here we are with the BA.2 variant, and we are going to see again a slow motion train wreck while all this stuff unfolds in the next few weeks and months. And then that's going to still lead to people being even more tired and frustrated and angry months from now, while there are more people dead in various corners of the world and healthcare systems pushed even further to the brink of collapse, all while we steadfastly and our leaders steadfastly refuse to do the right thing. And all I can do here is spread this information to people, and hopefully you spread it to other people, so that people who actually care and are doing their best can try and continue to do so, and can try to protect those that they love and care about. But unfortunately, we can't stop this slow motion train wreck from happening, and that's what's bothering me today.